start session 2. And just to let you know, session 2 is going to be around 45-50 minutes, and then we do have time for a quick break, a 10-minute break after that. So the next session is going to be very exciting. It's going to be hearing from 4 different representatives from Pacific countries about their experiences of their recent outbreaks. And hopefully this will be very informative and cause a lot of reflection for us in terms of moving forward. This session will be facilitated by Mr. Edgar Pollard. So take it away, Edgar.
Thanks, Amanda, and good morning, good fellow morning, everyone online. Welcome to our second session where we'll be having a talanoa or talk story, sharing lessons from our different countries. And it's extra special session because our 4 presenters are actually mentees in our PacMOSSI mentoring program. So we look forward to hearing their stories this morning. So the 4 presenters we have are Lesieli from Tonga, Tulia from Fiji, Nelson from the Cook Islands, and Alosio from Samoa. So they'll have short presentations for us, and then we'll follow that up with a question and answer time. So please keep your questions coming through the chat group, or you can have them ready for afterwards. So without further ado, I'd like to invite Lesieli. I hope you're online to begin.
Yeah, thank you, Edgar. Malolei, everyone. Good afternoon from Tonga, as it in the afternoon here, but I know it's still morning for majority of you. So I'll be presenting based on the dengue outbreak here in Tonga in 2025. So as you can see, that's my name, and also my post at the moment. I'm looking after the environmental health, climate change, and disaster section here in the Ministry of Health, Tonga. Next slide, please, Sally. So brief background on the outbreak here in Tonga. So we got notified on the first case on the 13th of February, 2025. And then from then on, we started implementing on the first case, just action from the environmental health side and the health promotion. And then by 19th of Feb, we declared an outbreak here in Tonga with a total of 10 cases that was reported. In initial cases was seen in Tongatapu and then Hawaii, and then further on spread to Vava'u and Eua. Sorry, it was first in Tongatapu and Vava'u, and then Eua, and the last island that's now spread to is Hawaii. The only island group that's still safe with no dengue case reported here in Tonga is the 2 newest, which is the furthest island from the main island. The serotype for the dengue virus that's spreading in Tonga so far is noted as type 2, although there's been another patch that's been sent for serotyping again, just to reconfirm that we only have type 2 here in Tonga, and the most affected group is the age group from 10 to 20 years old. This is thought by the epidemiology team is because the last outbreak here in Tonga, this age group was not exposed to this. So that's why majority of the age group of the people being affected is from age 10 to 20. Next slide, please. Ongoing activities towards the dengue outbreak. So our main focus at the moment is to reduce the mosquito population and also preventing the human mosquito contact. So by reducing mosquito population, we're carrying out vector control by doing larvicide and insecticide spraying in the affected areas and also the vulnerable areas. So vulnerable areas, we have noted those are the hospital, the health centers, even the boarding school. Those are where we are doing the spraying. And also we do community engagement by carrying out cleanup just to remove breeding sites, and also inspection to enforce this cleanup by individual household. So with regards to the preventing of the human mosquito contact, we do health talk by community awareness, TV and radio program, and also there's been some implementation from our NGOs in distributing repellent and mosquito nets to affected households. And also we do case investigation on those people that's being found to be positive with dengue virus. Next slide, please. So with the insecticide spraying and larvicide application, the chemicals we're using is actyllic and icon. This is mostly available in Tonga Tapu, the main island. For the outer island, we have bifenthrin, which we're hoping to carry out insecticide resistant testing soon, because feedback from the people here in the main island, when they're using piphen, there's seen to be resistant from the mosquito. So, but we have not yet done the test to reconfirm it. But in the outer island, this chemical is still effective. With the target area, we do insecticide spraying, larvicide, and also the inspection is when we get a case confirmed, we do a 200-meter radius of insecticide spraying from the household case, and also the inspection. So as I mentioned, the vulnerable area, we do the insecticide spraying to healthcare facilities, the boarding school, and also the hotspot areas. And we do use the larvicide for the old and unused rainwater tank, which is in the community villages, and also with the swampy area where there's water stagnant in. Next slide, please. So with community awareness, we do a health talk at villages, churches, and school, and we also distribute pamphlets and brochure. And this is most effective when we translate it into our Tongan language. So that's one of the main things we've been trying to do, is to translate and do the awareness in our Tongan language. Next slide, please. So the content of the community awareness. So this is the content of what we give out, the information we give out to the public is, so what is dengue virus, and the signs and symptoms for people to pick up, and also to see when there's a dangerous signs and symptoms for the person who's affected with dengue, so they'd be notified to the hospital. Also stating how it is spread by the mosquito and what type of mosquito and its characteristic that's present here in Tonga that's spreading this, and also prevention, ways to prevent themselves from getting bitten by the mosquito or being more sick from the dengue virus. Next slide, please. So with community engagement, so we have our team out in the village doing household inspection. So that's a house-to-house inspection, ensuring that they eliminate and remove breeding sites, and also that they clean up pretty much the surrounding area. In one of the outer island, they did mass cleanup campaign. So they recruited the majority of the communities, and they started cleaning up that whole village, as seen by the picture. Next slide, please. So lesson learned from this so far. At the moment, we're still seeing outbreak here in Tonga. The outer island in Vava'o and Eua and Hawaii are limited. In Tonga Tapu, we're seeing increase in the number, although it was decreasing. So we were hoping to see it gone, but then a slight spike at the moment after our inter-college sports. And also we're looking that we're going to have a lot of mass gathering coming up, and people from overseas are going to visit soon. But the best practices and achievement we have so far, so thank you to Rod and also the PacMOSSI team for enabling and helping out to do the vector control training in Vava'o. So Vava'o was the highest number recorded so far, but now Tonga Tapu has spiked over Vava'o. And also when the outbreak happened, we were happy that we had resources in place that we could use to mobilize and act towards the dengue outbreak. And also so far with the assistant of the PHO, we have done an interaction review on dengue outbreak with all the relevant partners within the Ministry of Health that we are working towards the dengue outbreak. Key challenges that we face when during this outbreak is information inaccurate or incomplete, and the timeliness. So the name of the cases we receive is they gave us the name and the age, and we go to the person, it's the same name but a different age, or they give us a place address, and when we go there, the address they relocated from that current address. And also we're noting that with short staff, we can't really implement our staff to do things, and also with doing mass cleanup, they require funding, so that's another challenges. And also with public's views and perspective, as dengue outbreak is now in a prolonged time, so they're sort of tired of hearing us implementing and telling them to do cleanup and also prevent being bitten by mosquito. And also with the signs and symptoms, sometimes they find it's similar to how flu is like and all those things. So those are some of the key challenges we faced in the outbreak so far. Next slide, please. Those are key stakeholders that we've been working through during the outbreak. So we have the Ministry of Health, Public Services Commission. So the PSC has helped in implementing us to have health talk to all the government workers. And also we have the district and town officers helping us with cleanup campaign, church leaders as well. When we do health talk to the communities, people are more at church than when we call the phono by the town officers. And we also have the Tonga Red Cross, PacMOSSI, WHO, UNICEF, Chinese government, and I think there's more that I have not yet listed here, but that's the key stakeholders that have assisted us during the outbreak. Next slide, please. Yes, this is on our initial health talk in one of the community that had the main outbreak people from. That's all from my presentation. Thank you. Next slide.